are there, schedules and schedules to the rules are there, and among these schedules, various schedules in detail we have to discuss. Okay, as I have told you that you should know at least in one line what schedule contains. For example, schedule A, what is schedule A? In schedule A, the various forms are there, various applications are there, and there in that applications, various how to apply. Okay, various specimen copies are there, various memorandums are there in this schedule A. In first schedule, the list of Ayurvedic Siddha Unani drugs are there. Like that, at least we should know. Schedule, what is schedule G, what is schedule H, what is schedule M. In this schedule M, that general requirements, GMP requirements are there in that schedule M. Then, what is schedule M? What is schedule X? So, that you should know properly. Okay. Now, when just I gone through your syllabus, if you are able to see the screen properly, that for your syllabus, after all, if you see this syllabus, this unit 1 and unit 2 is there. In this unit 2, unit 1 we have discussed in detail. So in unit 2, now each schedule in detail we have to discuss. What is there? That primarily what each schedule contains, that we have discussed. What is in the form of definition or small introduction of each schedule, that we have discussed. Okay. What is schedule G is there, the list of schedule G drug, list of schedule H drug. It should be written as RX at left top corner of the label for schedule H drug. The notice should be written that this drug is sold only on prescription of registered medical practitioners only. That schedule H is there. The schedule M, in short, you are knowing that it is a GMP requirement, general requirement for factory premises where the manufacturing is going on. So like that, so in general, we have discussed various schedules. Then some offenses, penalties also we have discussed. Labeling requirements also for drugs and that we have discussed, which are the permitted colors. So again, in that administration of the act and rules, that also we have discussed in detail. Drug technical advisory board, central drug laboratory, drug consultative committee, government drug analyst, licensing authority, controlling authority, drug inspectors. So that points also covered from your syllabus. So now we are going to start one by one schedules. Okay. So among these schedules that already we have this schedule. So this detailed study of schedule G, H, M, M, P. See this G, H, M, M, P, T, U, V, X, Y. Part B of schedule, part F. So that are there in your syllabus in unit 2. So it is very interesting to study the pharmaceutical this schedule M. Okay. So we will start with schedule M. So from this schedule M, that general factory premises or general requirements of factory premises, that is there. We can say GMP requirements. Okay. So if we go to this, this is the actual Schedule M. You are able to see this PDF. This Schedule M is there. The title for this schedule is the title Good Manufacturing Requirements, Good Manufacturing Practices and Requirements of Premises, Plant and Equipment for Pharmaceutical Products. So these are the good manufacturing practices, requirements and of plant and equipment. So if you study properly the Schedule M, you are able to understand what is the setup of factory, how factory should be set. Okay. So there is no need of other guidance. Okay, itself Schedule M is there. It is guiding us about how factory should be set, and that setup is according to the law. Okay, that setup is according to the law, drug and cosmetic. See, the good manufacturing practices or current good manufacturing practices are there. That current good practices or good manufacturing practices, they are a worldwide guidelines. They are, we can say guidelines, how the factory premises should be set up. They are not guidelines, they have to follow. Then and then Food and Drug Administration and other bodies are there, regulatory bodies. The regulatory body means the bodies which are giving the permissions for particular type of task. For example, manufacturing is there. So Food and Drug Administration is there, state government is there, or central government is there. So these are all regulatory bodies related to manufacturing. So we have to follow that good manufacturing practices or current good manufacturing practices, and same good manufacturing practices is accepted and included in the Drug and Cosmetic Act, Schedule M. Then see the Gazette of India, Ministry of Health and Family Welfare. Okay, so Department of Health. So they have released the notification in New Delhi, 11 December 2001. So this is the latest Schedule M. This is an amendment. We can say M4 amendment is there. Schedule. So what they have told that this, see here, the rules may be called Drug and Cosmetic Amendment Rules 2001, and they shall come into a force on the date of the publication in the official gazette. Okay. So notwithstanding contain anything in sub-rule 2, these rules shall not apply up to December 31, 2003 to the manufacturers who are presently licensed to manufacture for sale of drug. So these are the in Drug and Cosmetic Rule 1945 for Schedule M. Following schedule shall be substituted, namely for Schedule M, these following schedules are substituted. This Schedule M amendment up to 30th June 2005, good manufacturing practices and requirements of premises, plant and equipment for pharmaceutical products. So this is part 1. In part 1, good manufacturing practices for premises and materials. So in that, all requirements are there in general, or while discussing a primary discussion about each and every schedule, we have discussed all that. Okay, general requirements, that is location and surrounding building premises. Okay, then water system is there. So each and every schedule, each and every point related to building and location, disposable of waste. So total 61 pages are there for this schedule. Okay, quality control area, production area, ancillary area, warehouse area, what is the requirement of that? See, each and every point is elaborated. If you remember the last points that we have discussed, so that last point, in short, we have discussed each and every schedule. So, what is the requirement of personnel? Person working in manufacturing area, production area, quality control area. Then what is the related their health, clothing and sanitization. Then how manufacturing operations and controls that should be carried out. What is the requirement of that all manufacturing operations. Then sanitization of manufacturing premises. What about raw material? How raw material should be kept? What is the guidelines or what is the rules for that raw materials to keep, to dispense, to give to other department like that? Then what is the related to equipment? What is the equipment? Their documentation and records in the manufacturing area or production area. Then related to labels and other printed materials that are used for that. In the quality assurance department, in self inspection and quality audit. So this is again very important, that self inspection and quality audit. Every time that manufacturer should carry out the self inspection, the time frame of that within 2 years or 3 years or 5 years, like that. The time frame should be fixed, decided, and apart from that, quality audit is there, like FDA audit, that should be followed. Apart from that, in quality control system, that how quality control department is there, system of that quality control department. Then various specifications are there. Master formula record, the batch manufacturing record is there, packaging record is there. So all records should be there. They should be according to the regulations. They should be according to the Schedule M. Then standard operating procedures are there. Sampling each and every point related to this Schedule M is there. We are going to discuss in detail. Okay. Testing, records of analysis, reference material. Just I am showing you the actual law or the PDF of gazetted document that is related to the Schedule M. And among all schedules, it is very interesting to discuss the Schedule M, because this is one of the training for you, that how industry can set up. Okay, schedule. If you study the schedule properly, Schedule M properly, you can set the industry, or you can well aware before going to any industry. See, when you are going for your industrial training, okay, at that time only you are going to see the industry. Okay, and you are not as such aware about the each and every department of industry, because very first time you are entering into the industry. Okay, as you are a pharmacist, you have to take the prior permissions for that to enter the industry. As you are a student of pharmacy, for your training purpose, you will get the permission. Otherwise, any person or a general person will not get the permission, okay, to visit any plant. But before visiting any industry, before visiting any manufacturing plant, if you are able to understand the Schedule M properly, if you understood the Schedule M, if you have studied the Schedule M properly, then it is easy for you to understand each and every department of industry. When you enter into the industry, while entering into the industry, how to do the clothing, okay, then which are the safety requirements, then which are the different departments there in industry, which are the type of formulation they are manufacturing in a particular type of department, how to take a precaution. Okay, so that is a prior training for you. That Schedule M is a prior training for you, that how you are going to set up an industry, or how you are going to understand the industry, pharmaceutical industry. As we are a pharmacy students, we are talking about pharmaceutical industry in this pharmaceutical jurisprudence or Schedule M. So again, in this Schedule M, Specific requirements for manufacture of sterile products, parenterals, preparations, small volume and large volume parenterals, and sterile ophthalmic preparations. So this related to parenterals also, sterile products also. This Schedule M is there, and in that Schedule M, that should be followed the good manufacturing practices for premises for types of products also. In that again, general requirements, building and premises, batch manufacturing record, in how to do the sampling. These academic preparations, they are comes under Schedule CC1. Okay. Ophthalmic preparations or parenterals are there. They are coming under Schedule CC1 mostly. Okay, as they are injectables and they are parenterals. They are under biological drugs. So they should be manufactured cautiously, carefully. Okay, and for that they should, or the industry or a department should follow the Schedule M for that purpose. How this record of analysis is there. Then again, the reference samples, reprocessing and recoveries of samples, their validation and process, their complaints and adverse reactions, the site master file, premises for that. We are going through the schedule. Okay, we are going to discuss each and every point, no doubt for that. But just part 1A, what is part 1B? So in part 1A is the specific requirements for manufacture of sterile products, parenterals, in that small volume injectables and large volume parenterals, and the sterile preparation, that is there in part A. In this parenteral, specifically air handling system is there, central air conditioning should be there, or how air handling system is there. That is very important, air handling system. If you visit our microbiological lab, there are proper air handling system is there, and how to prepare the formulation for that parenteral or injectable. That practical you might have gone through that, or in final year that practical will be there in pharmaceutical especially. So there how to work in a aseptic area, so that proper air handling system should be there. Then some airborne particulate classification for manufacture of sterile products. Some values are given, that values should be followed. Okay. M is given, that is a gazetted notification for Schedule M. In for Schedule M, as earlier we have discussed, that there are three types of Schedule M is there. Schedule M1, Schedule M2, Schedule M3 is there. Okay. Manufacturing process, water system, for each and every type of product, for each and every type of class of formulation. Okay, form fill seal technology or blow fill seal technology, how to seal the sterilizer product, that technology is there, that is mentioned in Schedule M itself. So I already told you. Then sterilization, which type of sterilization? By molecule sterilization. Then completion or finalization of sterile products, product containers and closure, how containers and closures should be designed, rubber stoppers, their documentation. So all types of manufacturing requirements, they are not just manufacturing requirements, they are good manufacturing practices. There are GMP practices first, and that GMP practices should be followed properly, and that all are included in Schedule M. Okay. Then first, the specific requirements for solid dosage forms, oral solid dosage forms. In that tablet, Part B is there. Part A, Part B, compression of tablet, how the compression is there, printing on tablet, printing, packaging on tablet, then filling of hard gelatin capsules. So for solid dosage form. Then Part 1C is there. In that, specific requirements for manufacture of oral liquids. Oral liquids that are syrups, elixirs, emulsions, and suspensions. So liquid dosage forms are there. Again, parts that Schedule M is there. That Schedule M covers these all requirements. Again, from manufacturing to premises, manufacturing, water system, other requirements for that. these types of products. Next is part 1B, Schedule M, part 1B. In that, specific requirements for manufacture of topical products, that is external preparations. In that, creams, ointment, paste, emulsions, lotions, solutions, dusting powder, and identical products. So this is part 1B. See, part 1 is there, Schedule M, part 1, then part 1A, part 1B, part 1C, part 1D. So for each type of part, there are different classes of formulations that are studied under this Schedule M. For requirements for that, manufacturing requirements, then part E is there. In part 1E, the specific requirements for manufacture of bitter dose inhalers, MDI, bitter dose inhalers. So many times for asthmatic drug, some inhalers are there, inhalation therapy is there. Just you inhale the drug, that inhaler pump is there. So that pumps where the patient is taking the drug. That category of drug is metered dosage inhalers are there, MDI. So again, for that manufacturing of that type of materials, again some points are covered in Schedule M. Each and every how to document that type of product. So that is covered in Schedule M. Then part 1F, the specific requirements for premises of plant and materials for manufacture of active pharmaceutical ingredient, bulk drug. So API or active pharmaceutical ingredient or bulk drug is there. For example, the bulk in the raw material, that raw material consisting of bulk drug. Okay, suppose we are manufacturing paracetamol tablet. So as you know now, many times we have discussed that paracetamol tablet is not just a paracetamol tablet, it is with excipients. Then and then it can be a tablet. If we are adding the excipients and we are compressing that properly with proper procedures and following good manufacturing practices, then and then it converts to the tablet form and it remains as it is for a longer time. Apart